Hello, this is Dr. Grande. Today's question is, what is the difference between schizophrenia and schizoaffective disorder? So let's start with schizophrenia. In criterion A, in the definition for schizophrenia in the DSM, the Diagnostic and Statistical Manual, there are 5 symptoms. 2 or more of the symptoms need to be met to be diagnosed with schizophrenia. Now, of course, there's other criteria as well, but I'm just talking about criterion A. So these 5 symptoms are delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. Now again, 2 or more symptoms need to be met, but one of those symptoms needs to be delusions, hallucinations, or disorganized speech. The signs of schizophrenia need to be present for more than 6 months for that diagnosis. Now moving over to schizoaffective disorder. Schizoaffective disorder has the same criteria as schizophrenia, except we add this major mood disorder piece, this major mood episode. And this would be something like bipolar disorder or major depressive disorder combined with schizophrenia. And I think this is where this becomes confusing. It becomes difficult to differentiate now several disorders: schizophrenia, schizoaffective disorder, and bipolar disorder or major depressive disorder. So let's look at the 4 criteria for schizoaffective disorder. Now again, the full criteria for schizophrenia needs to be met to start with. So starting with criterion A of schizoaffective disorder, now this can become a little confusing here as well, because criterion A of schizophrenia is different than criterion A of schizoaffective disorder. Criterion A of schizoaffective disorder references those 5 symptom criteria, criterion A, in schizophrenia. But these are separate constructs. So in criterion A of schizoaffective disorder, a major mood episode must be concurrent with criterion A from schizophrenia, with 2 or more of those 5 symptoms, with one of those 5 symptoms coming from the first 3. Now, with the major depressive episode, so if the major mood episode is a major depressive episode, the depressed mood symptom must be met. So that's specifically the depressed mood symptom for a major depressive episode. There's another way to be diagnosed with a major depressive episode, and that's diminished interest or pleasure, but that's not qualifying for schizoaffective disorder. Now, criterion B for schizoaffective disorder helps us differentiate schizoaffective disorder from bipolar disorder or major depressive disorder. So with criterion B, delusions or hallucinations must be present for 2 weeks or more in the absence of a major mood episode. So again, this helps us differentiate between a schizoaffective disorder diagnosis and bipolar disorder or major depressive disorder. So more than 2 weeks in the lifetime of the disturbance. So it just has to happen one time where we see the delusions, hallucinations without the major mood episode. It has to be at least 2 weeks. Criterion C helps us differentiate schizoaffective disorder from schizophrenia. And here we see that major mood episode symptoms must be present for the majority of the active and residual phase portions of the illness. Now, what's interesting about criterion C is this allows the diagnosis to change from schizoaffective disorder to schizophrenia and back potentially several times over the course of someone's lifetime. And this isn't considered unusual. So at one point, a mental health practitioner could be working with a client who's had 3 years with the symptoms of schizophrenia, and the major mood episodes been present for 2 years, so that would be the majority. Later on in the treatment of that client, the major mood episode could have stopped, say it could have stopped at 2 years, yet the delusions and hallucinations, what we see typically with schizophrenia, would continue. So say that the schizophrenia symptoms were present for 6 years and the major mood episode for only 2 years, then the diagnosis would go back to schizophrenia. Criterion D of schizoaffective disorder says that substance use can't better explain these symptoms. So there's also two subtypes with schizoaffective disorder. Not specifiers, there are several specifiers, but two subtypes. So an individual with schizoaffective disorder would have to be classified in one of these subtypes. There's the bipolar type and the depressive type. So with bipolar type, the major mood episode that we're referring to in schizoaffective disorder would be mania, and with the depressive type, it would be depression. Some other interesting characteristics of schizoaffective disorder. Typically, the negative symptoms we see with schizophrenia, and of course could see with schizoaffective disorder, are less severe with schizoaffective disorder. Also, the lack of insight that's fairly common with schizophrenia, anosognosia, is less severe usually in schizoaffective disorder. Now, the prognosis for schizoaffective disorder is actually better than the prognosis for schizophrenia, which may seem surprising because schizoaffective disorder has the features of schizophrenia plus the mood disorder. The prognosis for schizoaffective disorder, however, is worse than a major mood disorder, bipolar disorder, or major depressive disorder. Another question I get a lot about schizoaffective disorder is, can an individual simply have schizophrenia and bipolar disorder, or schizophrenia and major depressive disorder, and not have schizoaffective disorder? Technically, the answer is no. If an individual meets the criteria for schizophrenia and bipolar disorder or major depressive disorder, then the diagnosis would be schizoaffective disorder. That is really a combination of bipolar disorder or major depressive disorder and schizophrenia. We classify it as schizoaffective disorder. I hope you found this description of schizoaffective disorder and schizophrenia to be interesting. Thanks for watching.